About psychosis and primary care. So from the big picture, we know that there's really high rates of comorbid mental health conditions and physical health conditions across the spectrum of both mental health and physical health, as well as high rates of co-occurring mental illness and substance use disorder. Global data shows us that persons with severe mental illness have a greater risk than the general population of contracting and transmitting infectious disease, have a higher cost associated with their treatment compared to people without mental illness. They have a higher rate of diabetes compared to the general population, and obesity. So what that boils down to is premature mortality among people with severe mental illness. The global literature shows anywhere from a 1.5 to 2.6 higher risk of death, with the highest odds of death occurring among people with psychotic disorders and co-occurring severe mental illness and substance use disorders. Historical data shows us that in a community mental health system, consumers face on average a shortened lifespan of anywhere between 15 and 32 years. In the Veterans Administration, it's a little bit less, 12 to 15, because they tend to have a more integrated system. And a recent study, retrospective cohort study that looked at 2010 to 2017, that was published just this year, looked at the Kaiser Permanente system in California, a fully integrated system of medical and mental health care. And even within that system, people with psychosis died on average of 8.9 years earlier than the rest of the population, looking at about a 21.6 mean years of life lost. Most of these deaths are attributed to heart disease, stroke, cancer, and other natural causes, while suicide is definitely another significant cause. Within the 2021 study, their data was similar to the historical literature. So heart disease and cancer accounting for, you can see, about anywhere from 32 to 42% of people with severe mental illness. Suicide was a highest risk of death, the highest percentage of deaths for people with suicide, with specifically with bipolar disorder. But the historical literature does point to a lifetime suicide rate for individuals with schizophrenia around 10%. And when we look at this, we have to consider, all of the major bigger pictures with this. So you can't separate out the mental health and physical health conditions without really taking into consideration and looking at social determinants of health and social determinants of mental health. So people with first episode psychosis, we know, have a number of behavioral risk factors. Historical literature has shown that people with first episode psychosis tend to have 27% have an alcohol use disorder of some sort or using alcohol in excess. 58% use tobacco. They tend to be less active and have a significantly reduced sleep time and quality of sleep. We know that there are high rates of poverty for people with mental illness. And it's really a two-way relationship between mental health issues and socioeconomic issues, where mental health disorders can lead to reduced income and employment, which often entrenches people in poverty, and there in turn increases the risk of developing a mental health issue. There's also higher rates of psychiatric hospitalization amongst impoverished populations, and there's reduced access to care for a variety of factors, of which transportation is just one. And a study published in the American Journal of Preventive Medicine determined that food insecurity was actually one of the things associated with poor mental health and specific psychosocial stressors across global regions, which is why I wanted to take a little bit of a look at food insecurity when we're talking about primary care and holistic care for persons with psychosis. It's not an area that might not be discussed or considered nearly enough, but food insecurity in youth has been correlated with the development of chronic medical conditions and has actually been shown in a 2018 study to predict mental health service utilization. After adjusting for demographic variables, adults in severely food insecure households utilize mental health services at 2.16 times the rate of other in comparison to those in food secure households. And there are a number of socioeconomic and policy factors that limit access to healthy food for people with severe mental illness, including limited knowledge, skills and experience with food purchasing, sometimes food planning and preparation, storage, poor quality food that's accessible, as well as homelessness, housing issues, and access to affordable, high-quality groceries and grocery stores. So what can we do about it, or what should we do about it? The World Health Organization recommends the 3 major lifestyle interventions that are considered the first-line strategies: so smoking cessation, physical activity, and nutrition. And one of our primary partners in all of this can be primary care. They're really a critical partner in both identifying early signs of mental illness and potentially connecting people to the mental health system earlier. But we know that people with schizophrenia, despite with all of their significant health disparities, are less likely than those without mental illness to seek or actually have good access to primary care. Many have more difficulty in obtaining or maintaining health insurance and getting access to regular, consistent care. So primary care physicians can be a very important part of not only identifying sometimes the early mental health systems, but in partnering to identify and look for medical symptoms. So comorbid medical issues, looking for the early signs and symptoms of things like metabolic disorders, really watching the medical labs to make sure that we're able to keep an eye on what's going on with people medically to try to prevent some of the early or the premature mortality. And one of these areas that we can partner with primary care on is around food insecurity. So I listed some websites, both for national and Ohio resources to access food assistance programs, helping clients connect to, first of all, get connected to any kind of food assistance that they might need, like SNAP, and then being able to find farmers markets in their area that maybe accept SNAP. A number of farmers markets throughout Ohio do accept SNAP, and many of them will do kind of a 2-for-1, so you're getting twice the amount of produce that you would if you were paying with cash if you're actually using your SNAP benefits. Beyond that, we might actually have to help clients access transportation so that they can, in addition to accessing primary care, also be able to get to any of the food services that might be available. And then looking a whole step outside of that is being able to help them access means of learning how to prepare meals that are healthy, just some cooking classes, basic things that are going to help people learn how to really reinvest, take a different look at their diet and nutrition than they had before, which can be difficult for all of us, honestly, but particularly difficult for people who have a severe mental illness or schizophrenia. And I wanted, before ending, to give an example of a really effective integrated system. So the Hope and Health Wellness Clinic is a program and team that was embedded in a community, in partnership between a FQHC, so Federally Qualified Health Center, and a community mental health center. So the Hope and Health Wellness team coordinated closely with the mental health team, and that team consisted of the behavioral health provider, a care coordinator, a referral coordinator, a peer specialist, primary care provider, and a medical assistant. This entire program also included a free fitness center and access to a personal trainer. So they were able to address things like nutrition and diet, but then actually that physical activity piece of it, start talking about smoking cessation, getting a very comprehensive and well wrapped around care system for these individuals. They also had shared records, which definitely improves the ability to communicate across systems. And what they found in a retrospective, so they looked backwards at the 4-year span, and they showed that people were very happy with the care that they were receiving. Those who had at risk for alcohol or tobacco use showed significant improvement. And at least a third of the clients were in a risk category on physical health indicators at baseline. But a good number of them, those with high cholesterol, triglycerides, and blood pressure, showed statistically significant improvement. When you look at those who had been the most at risk, they showed the most improvement by the end of the study. And all of the clients who were involved with this reported positive social connectedness, improved everyday functioning, improved perceived health, and reduced psychological distress. So in summary, we know that individuals with schizophrenia have a significant number of risk factors and a significant number of health disparities, all of which lead to shortened lifespans and years of life lost. Food insecurity is one major area of concern that can be addressed by both physical and, for both physical and mental illness, but it can be addressed by both the mental health and physical health primary sides of the care system. The consistency of medical visits and medication management are key in the management of chronic medical conditions, especially when people are struggling with competing demands, like things like food and access to transportation. Sharing records can enhance communication and coordination, but access to an integrated system alone doesn't alleviate mortality. Looking at the Hope and Health Wellness Clinic, what we can see is that there are examples of how careful coordination and strong relationship building can improve the health and wellness of individual clients and patients. So maybe if we continue to see more programs like that and getting close with primary care and having more coordinated, comprehensive care system, our current and future clients will face better, will live longer lives and healthier lives with more positive outcomes than maybe clients in the past have. And around integrated care things, we have our Friday Integrated Care Echo, which we're always happy to see new faces at. You could always reach out to Jamie or sign up online. Some references, and now I'll stop my share.